I can remember I was walking my dog with my wife and my phone started ringing on a Saturday. And in our largest facility, where we're most vulnerable, the people who are older or medically frail, really and live together in a heavy congregate setting, they started getting sick.
We had a resident that was not doing well. She was older, has some health conditions. It really didn't appear to be anything out of the ordinary. We sent her to the hospital for evaluation just as we normally would have, and I was sitting at my desk and I got a text from the administrator of the Commons saying that that person was positive. And it took me a minute to process positive. Kind of had to take a couple minutes and, think about what did this mean for that building? What do we do next? That was a moment when I decided we just needed to shut down the entire building and quarantine individuals. And then it just felt like from that point on, it was one person after the next they were calling 911 for, and they were testing positive.
We had some of our Wilkie ladies whose vital signs were not quite in the normal limits. And so we had to call 911 and they wouldn't come in the house. And that was one of the scariest things that I've ever experienced because I didn't know how I could keep everybody safe and what I could do when those that I call aren't able to help us.
It wasn't just one at a time, it was 1, 2, 3 at a time. People were going up to the hospital, and that went on for days, and the phone just didn't stop ringing, and people kept going up to the hospital, and people got sicker, and staff were getting sick, and unable to come in.
There was one night we called in less than 2 hours, I believe, 5 times. And every time they came back, the same paramedics, they had to start rerouting people to different hospitals. I think that because, again, they were scared. They were like, can't you handle some of these cases there? Because they didn't know where else to take our guys. We had to say no, it's beyond our scope. We're not skilled care. We have nursing care.
Yeah, that was, I think, the hardest part, when they're like, we can't come in the building and you have to lift these people and get them to the front door. That was hard, but that was at the height, the true height, even in the community and the hospitals, and everyone was doing their best that they could given the circumstances.
As people were brought to the hospital, the staff kept coming back, and their job's hard enough as is, but now they're going to take on these risks for themselves and then going back to their families. I didn't think that they'd be up for that. I questioned if I'd be up for that. And so when it did hit at that level, and they just kept coming.
I chose to stay, and I talked to some of the other co-workers too. I told you that you did not have to worry about me not coming to work. I will be there every day. This is my Clearbrook, my comments, and we're in this together, and I'm not gonna run away.
I was blown away at their just, we're here, we're gonna be in it, and everyone kind of banded together.
Our nursing department is small. They were taking on a huge workload. We had one nurse in particular, very early on, go to stay at a hotel, and she left her 9-month-old baby with her mother. I can't imagine doing. An ultimate sacrifice that she made for our clients, and she didn't see her baby for 6 weeks. Their work environment changed also, so to come to work, they had to put on a mask, sometimes 2 masks, a face shield, goggles, a hair covering, a plastic gown, which was really, uncomfortable. And then they had to go work for 16 hours or longer. And they did it with a smile. Without that group of staff that worked through the heart of the outbreak, I don't know what would have happened.
And the residents were rock stars. Having to make a change of staying home and not going to day program and then having to stay in their halls and in their rooms. Truly they handled it probably better than the general public did. But they just, okay, this is what we're doing now. This is COVID. We don't want to get sick. We need to stay safe. And that's kind of just what we did.